Community Health Worker Training, Cardiovascular Health and Diabetes, Module 3C, Diagnosing and Treating Heart Failure. Learning outcomes. Explore procedures for diagnosing and treating heart failure. Identify community health worker activities to create care connections for people with a history of heart failure or at high risk for heart failure. Diagnosis and treatment. How is heart failure diagnosed? Well, the care team looks at the client's medical history, their physical exam, a chest x-ray, blood tests to check for problems with the kidneys or with liver function. An electrocardiogram, or EKG, checks how thick the heart muscle is and how well the heart is pumping. And an echocardiogram, ECG, checks the heart rhythm. And finally, some clients need cardiac catheterization to look for blockages or damage to the heart. And that's an invasive procedure where a small tube is passed into the vein and a little camera is on it and it goes up into the heart to take a look at whether there's blockages in the coronary arteries. Click on this link to see a little bit more in-depth explanation of what an electrocardiogram is and what it does.
Knowing what to expect when you go for medical testing can help lower your stress and allow you to be in charge of your own health. Today, Jackie is checking out a common test for heart health. Today, I'm getting an up-close look at an electrocardiogram. I'm here today with Dr. Silverman. And doctor, for those who aren't familiar, what does this entail?
An electrocardiogram, which is most commonly referred to as an ECG, is the sort of fundamental test that we do in cardiology, and it generates a pattern of 12 electrical impulses from the heart. We can learn a lot about whether or not the patient has underlying heart disease, if they're in a normal heart rhythm, etc. There are 10 electrodes that are attached to the skin, basically just little sticky patches that go on the arms and legs and then across the chest. And by recording the electrical activity between those 10 different electrodes, it generates 12 distinct patterns on the ECG that we use to diagnose heart disease.
Tell me about what you're looking for in the printout of the result.
Well, the first thing that we look at is what's the patient's heart rate. Is the heart rate normal? Is it abnormally fast or slow? Then we look at the heart rhythm. Is the heart rhythm coming from the heart's normal pacemaker, or are they having an abnormal heart rhythm? And then beyond that, to see if there's any evidence of enlargement in chambers of the heart. Has the patient had a heart attack? Could they be having a heart attack now? The way the leads are configured, they go around the heart so that we can sometimes localize abnormalities to a specific part of the heart depending on the pattern of the ECG.
Who would be a likely candidate to get this test?
The most common reason is somebody has some complaint that their physician is concerned about, whether it's palpitations, chest pain, shortness of breath, etc. So today we're going to put on just the 4 limb leads. If this were an actual ECG, we would put on also 6 other leads on the patient's chest. They have a place for the electrodes to hook up. Usually we do this with the person lying down because it helps keep it a little bit more stable.
Okay. All right. I'm all attached now.
Now you're all attached. And now you actually can begin to see.
Okay. Oh, wow. How are things looking?
Well, in the little bit that I can see so far, so good. I can tell you that you're in your normal rhythm.
Okay. Should I be feeling anything at all?
No, because this is just basically recording the electrical activity that's present in your body, and it's not generating any electricity on its own.
So my main takeaway from this is that this is quick, it's painless, and it can really give your doctor a lot of important information about your heart health.
It's completely non-invasive, and the patient doesn't feel any discomfort.
All right. Thank you, doctor.
My pleasure.
And for more on how various medical procedures work, head to our website, livinghealthytv.com.
After being diagnosed with heart failure, what is the treatment? Heart failure cannot be completely cured, but it can be treated. Treatment can keep people feeling good and leading productive lives, often for many years. To treat heart failure, a doctor usually prescribes medicines and will recommend rest. It's important that people take medicines the way their doctor or nurse advises them. Also, people need to weigh themselves every day to see if they are holding on to extra fluid in their bodies. There are medicines that can treat mild or moderate heart failure, but in severe cases, surgery might be needed or even a heart transplant. But it's very important for a person who has had heart failure to carefully manage it by making lifestyle changes, including weighing themselves every day to see if they're holding on to extra fluid, resting as needed, getting regular mild activity like walking, and their healthcare team will tell them more details about how much walking is safe for them to do, following a low salt, low sodium, and low fat eating plan like the DASH diet, which we'll talk more about in a later class, losing weight if they're overweight, stopping smoking if they're a smoker, avoiding alcohol, avoiding or limiting caffeine, including coffee, tea, and cola. They should ask their doctor how much liquid they can drink each day and ask if they need to record the amount that they drink. They should manage stress, check their blood pressure, write down the numbers, and bring the record of their blood pressure readings to the doctor's appointments, and avoid wearing tight socks and stockings that could cause blood clots. So now we're going to focus for a little while on taking medicine and how community health workers can support people to take medicine regularly. Doctors usually prescribe one or more medicines to treat heart failure. Sometimes one medicine is given at first and others may be added later on, or two or more medicines may be given right from the start. It's easy to become confused about when to take medicine if a person needs to take several medicines at different times during the day. Even so, it's very important to take medicine as prescribed. So stop for a minute and think about what are some things people could do to remind them to take their medicine as prescribed. Pause the PowerPoint and jot down a few ideas. Some tips for taking medicine correctly after heart failure include: take the pills at the same time every day. Write down when you take your medicine. Put medicine in a labeled pill box. This is especially helpful if someone has to take medicine 2 or 3 or 4 times a day. You buy a pill box that has that many slots for each day, and it helps them remember what they've already taken and what they still need to take. Put a reminder sticky note where you'll see it on the bathroom mirror or on the refrigerator, for instance. Link your pill taking to something you already remember to do, like having your coffee or brushing your teeth. Ask a friend or family member to remind you. Use a phone app or a phone alarm to remind you. Use a pre-filled bubble card from the pharmacy. It's also really important to remember to refill prescriptions before you run out, and to bring plenty of medicine with you when you go on a trip. And just as an aside, if a client goes on a trip and forgets to bring their medicine with them, oftentimes they can go to a local pharmacy, and that pharmacy will call the pharmacy where they normally get their medicine, and they can provide the client with usually a couple of days worth of their medicine until they can get back home again. So what is the role of community health workers in helping to educate the community about heart failure and ways to prevent it, and also lifestyle changes that they may need to make after being diagnosed with heart failure? So community health workers can help community members who are at risk for heart failure to prevent getting it in the first place. It's really important to meet the patient wherever they are, right? Use motivational interviewing techniques and be aware of what stage of change they're at. Educate them about the warning signs of heart failure. Talk to them about the importance of taking blood pressure medicine regularly, because if they can control their blood pressure, it reduces the risk that they'll have heart failure. Educate them about the importance of eating a low sodium diet and the importance of staying active. Talk about the importance of not smoking if they're not smokers already, and help them to get into smoking cessation programs if they are smokers and they're willing to try to quit. And again, remember to use those motivational interviewing techniques to help people make better lifestyle choices. The goal is not to get them to make a giant change in one day. The goal is to get them to make change that they can stick with for the rest of their lives. Now you can explore procedures for diagnosing and treating heart failure and identify community health worker activities to create care connections for people with a history of heart failure or at high risk for heart failure. Congratulations on completing Module 3. Don't forget to go to the Google Classroom to complete the assessment for Module 3, heart failure. The next module is Module 4, atrial fibrillation.